Bring the first of our pitching companies up here right now. Investors, prepare yourselves. Vijay Reddy is the CEO of Nubis Health. At the tender age of 20, he left his native India and went to the United States of America. His company is headquartered in Georgia. I'm not going to say a lot about the company because that's his job. He has 8 minutes, at which point I jump up on stage. We got 2 minutes for the Q&A. Get your app out. Ladies and gentlemen, we're going to give him his 8 minutes. Vijay, you ready to go? He's ready. Ladies and gentlemen, let's welcome Vijay Reddy. All right. Here he comes. He's going to deliver from the podium. Go get him. Okay.
Good afternoon, everyone. I hope you could hear me. This is my first visit to Hong Kong. It's been humbling and nice to be here. And it's an honor to be here amongst you. And thank you for making this happen. And yeah, as you know, I'm Vijay. I'm the founder of Syntheum Health. I started my career about 26 years back. By profession, I'm a software engineer. Started with a healthcare technology firm as a developer, and then progressed to become the CIO of that company. And then, something started, urge to go and make a difference in what we do in this life. So started being an entrepreneur. And since then, last probably 15 years or so, ventured into a lot of healthcare and technology, and being foolish, being silly. But, it's all about being silly, I guess. So over a period of time, I noticed in healthcare, there are two things, that's common, especially being in the US for so long means what I see, in the healthcare and technology, working in the industry in different sides of the equation. It's more you work, less you know. I'm here to say that I don't know a whole lot. I know little of different pieces in the healthcare side. But one thing I know is cost in healthcare is unsustainable. And errors are not reasonable. Even in this day and age, over 300,000 people die due to misdiagnosis or errors. So we thought, let's make the difference. About 8 years back, I set out to, why the cost is so much. There should be something we could be doing. So I started thinking, okay, automation. Automation is one thing we could do and maybe make a difference. And started working on, my analogy is industrial automation. Without that, for example, you take the automobile manufacturing. Without the automation, the cars, producing a car would have been 3 to 5 times more expensive than what it is now. But thanks to the automation. So I got the inspiration, we have to do something about this. But healthcare is filled with a lot of data. And we wanted to make sure that, the computers are not meant to handle imprecise data. So we need to do something about the data. Without standardizing the data, how you can have an intelligent machine. So that's where, I started looking at different angles, and then we believe that, the next doctor going to be a computer algorithm. That's where, but for a computer to be an intelligent algorithm, you need to have smart data that is precise. You cannot be saying maybe. Maybe doesn't work with computers. Maybe doesn't work with I know there is fuzzy logic and all that, But really, when you are dealing with life and death, you need to have precise data to represent. So that's where we started. So let's take the journey a little bit. And again, as you can see, the cost of healthcare is 17% of the GDP, just US alone. Take that into perspective. It's all the world GDPs combined except China, Japan, Germany, and UK. That's how big the cost overruns in the healthcare sector is. So, and again, the next is errors. As I mentioned earlier, errors has been pretty significant factor there. So I just wanted to take to the next level, which is, having humans and machines can have a healthy life, low cost and predictable diagnosis, timely done. So that's where we were heading. And I came up with something called, knowledge base. What is the knowledge base? Why we need a knowledge base to tell, what is wrong with you. There is a lot of healthcare professionals that are there. They're highly trained, but the cost of providing that at your time, this is instant communication, instant gratification zone. If you want instant help, you need to use computers. You need to go there, log in, and then get. So again, shortage of time, I will skip through some of these things. This is one of the things that, just to give you a glimpse, why it took 8 years to bring, a lot of the information. So here, what we built is the foundation containing all the healthcare factors. We had over 300,000 health factors, and then building the interconnectivity between them. For example, take here, it's just one factor, healthcare, which is headache is a symptom. And if we take, that's directly coming from our database. If you take just one symptom and see, so many interconnections that exist alongside, the evidence-based medicine, if you interconnect with the factors and stuff, it will be truly remarkable. And having a system with the precise information at the time will have tremendous benefits over a period of time. Probably in the next 5 years or so down the road, you will see a computer that can take your medical assessment and then tell you what is wrong, or maybe what should be the next thing you have to, next food or next lifestyle change that you have to make in order to stay 100 or beyond. And the world in general is getting older. We need more automated tools to help care for our elders and ourselves. So that's why I know we are here. And as you can see, our application, knowledge base is the basic foundation. On top of it, we can build several applications, including one of them is Nubis Health, and with patient lifestyles and profiles. And I can give you our application a quick look, so that can ask you, So this is an application that we built that is meant to give you medical advice. I know it is not applicable in certain areas of the world, but we wanted to go country by country, and then based on the rules and regulations, we wanted to implement them. So basically the application will get the patient profile and then diagnose instantaneously. What could be potential issue, what kind of tests you can do. This is the series of questions it asks. These are like, intelligent bot, but related to the symptoms that you are experiencing. So based on that information, it will ask you a series of questions and then assess. It has your medical profile, and then it sees what would be, for example, here the potential issues due to red eye. So these are, different diagnoses it came out with, and then what could be the, diagnosis and things of that nature. So we are just jumping through the application so we can, move forward. So I guess that is the brief. I'm running out of time. And on top of that, we also built medically approved, all the human anatomy knowledge. So that's that. I will take the answers now, questions now.
Okay, so Vijay, you've eaten into your Q&A time, and we are trying to keep things on a tight schedule here. So we are going to let you go. So ladies and gentlemen, we had Vijay. He's used up his Q&A time, so no time for Q&A, but let's have a big thank you because it's exciting technology. All right, so Vijay, if you guys want to get him, you're going to have to Q&A him over lunchtime, which I'm sure people will want to do. Grab him, maybe even buy him lunch.